Hello, everyone, and welcome back to the Rhode to Pregnancy podcast, where we provide you with pregnancy-related information and local accessible resources here in Rhode Island. I'm one of your co-hosts, Ashley Houlihan.
And I'm your other co-host, Malia. Thank you for joining us on another episode of Road to Pregnancy. As we continue walking you through the third trimester this season, we wanted to focus today's episode on a major topic, preeclampsia.
Now, many of you may have heard of preeclampsia, watched some videos about it on social media, or even know someone who's been diagnosed. This condition can bring up a lot of anxiety for patients, but we're here to help clear any uncertainty and help you feel more educated and empowered.
We're so excited to welcome Dr. Srilakshmi Mitta back to the podcast. Dr. Mitta is an assistant professor of obstetrics and gynecology and internal medicine at the Warren Alpert Medical School of Brown University. She is an internal medicine physician who specializes in the medical care of pregnant patients.
Dr. Mitta, thank you so much for coming back to join us on another episode of Road to Pregnancy.
Thank you both. I'm so excited to be back. It was so much fun the last time, and I'm really happy to be asked back.
Now, for any of our new listeners who didn't get a chance to listen to your episode with us in season 2 on headaches and fatigue, which you should listen to if you haven't already, can you please remind us a little bit about your role in obstetric medicine and the kinds of patients that you work with?
So I'm an internal medicine or adult medicine doctor, and I specialize in something called obstetric medicine, which is a unique field that grew out of the need for more medical expertise in the care of pregnant and postpartum patients, especially as more patients are entering pregnancy with complex medical conditions. So in my role, I care for patients preconception, which is before pregnancy or when planning to get pregnant, as well as during pregnancy and after delivery, and we see a wide range of medical conditions, including chronic diseases like thyroid disease, hypertension, asthma, and diabetes, as well as common medical concerns like shortness of breath, dizziness, headaches, palpitations, and then complex conditions with the heart or the hematologic system. We work really closely with the OBs or any obstetric provider to support both maternal and fetal outcomes.
All right, so let's start our conversation really broad. What is preeclampsia?
Yeah, that is a good place to start. Preeclampsia is a complex condition that occurs in some pregnancies where someone develops high blood pressure along with signs that other organs are being affected. And most commonly, those organs that we see are affected are the brain, kidneys, or the liver. And it's really a disorder of how the placenta and the maternal body are interacting, and it can affect multiple systems, which is why we take it really seriously.
How and when is it diagnosed during pregnancy?
So preeclampsia is thought to be caused by an abnormal interface between the placenta and the mother that starts early in pregnancy when the placenta is forming. However, the signs and symptoms don't usually show up until later, so it's typically diagnosed after 20 weeks of pregnancy. The diagnosis is based on elevated blood pressures along with other findings like protein in the urine, abnormal labs, or certain symptoms. A lot of times this is picked up during routine prenatal visits, which is why those visits are so important to go to.
And if someone has preeclampsia but they haven't been officially diagnosed yet, what symptoms might they notice on their own that they should bring up to their healthcare provider?
So sometimes, and in fact many times, patients may notice symptoms before a diagnosis is even made. Things like persistent headaches, vision changes such as blurry vision or seeing spots, right upper abdominal pain, new nausea or heartburn-like pain, or sudden weight gain with noticeable swelling can all be early signs that you might be developing preeclampsia. Recognizing these symptoms and then alerting your obstetric provider is really crucial for early detection and diagnosis. In addition to this, routine blood pressure checks and urine testing are key and are part of every prenatal visit. But if something just doesn't feel right or you're feeling different or something is concerning, it's always worth bringing it up to your provider.
Okay, and I know you said the diagnosis, one part of it is based on those elevated blood pressures. So is preeclampsia different from gestational hypertension or chronic normal hypertension before pregnancy?
So, yeah, gestational hypertension is high blood pressure that develops in pregnancy after 20 weeks of gestation, but it doesn't have any evidence of organ damage or symptoms of preeclampsia like we just spoke about. Preeclampsia, on the other hand, includes both high blood pressure and evidence that other systems or organs are involved. Chronic hypertension, on the other hand, is high blood pressure that was present before pregnancy or diagnosed early on in pregnancy. So they are related, but they're not the same thing, and they're managed differently as well. So this is actually a really complex topic, but if someone has chronic or pre-existing hypertension, it's really important to get pre-pregnancy or preconception care to make sure their medications are safe for pregnancy and to understand the risks. It is not a reason to not have a baby, but it is a reason to be prepared for a healthy pregnancy.
Yes, you've heard us say it before and we'll continue to say it. Preconception care is so important. And what are some of the risk factors for preeclampsia?
So there are several risk factors for preeclampsia. Having a first-time pregnancy, a history of preeclampsia in a past pregnancy, having chronic hypertension, pre-existing diabetes, kidney disease, some autoimmune conditions, and multiple gestations like a twin gestation, or having a higher BMI or body mass index can all increase your risk of getting preeclampsia. But importantly, it can also happen in people without any clear risk factors, which is why it's super important to always go to your prenatal visits for screening and to watch out for symptoms.
I think that when many people receive a diagnosis like gestational diabetes or preeclampsia, they immediately wonder if they did something to cause it. So, Dr. Mitta, in most cases, is there anything patients have done to cause preeclampsia?
This is something I talk about with all patients all the time. Preeclampsia is definitely not something you caused. It's not from something you ate or didn't do. It's really related to how the placenta develops and how the body responds to pregnancy. There are risk factors to getting this, but many are not modifiable. So I really try to reassure patients that this is not their fault.
Can someone prevent preeclampsia?
That is such a good question and also one of my favorite topics. But unfortunately, we don't have a perfect way to prevent preeclampsia. But for patients at higher risk who we can identify based on the risk factors we talked about before, we often recommend a few key things. First, is regular exercise before and during pregnancy. Evidence and data shows that 150 minutes a week of mild to moderate exercise in pregnancy can significantly reduce the risk of preeclampsia. I think you mentioned this on a previous podcast, so I want to reiterate how important the exercise in pregnancy is. Second, if someone doesn't have a lot of calcium in their diet, increasing calcium intake to about 3 to 4 servings a day or taking 500 milligrams of calcium tablets twice a day may also help reduce your risk for preeclampsia.
And calcium can be found in like milk, dairy, those things.
Exactly.
Okay.
And lastly, taking a low dose aspirin starting early in pregnancy has also been shown to reduce the risk for preeclampsia as well. And as always, good prenatal care, close monitoring, and early detection are key, and listening to your body and the symptoms that might be telling you, I have preeclampsia, are important to listen to.
That's great that there are some strategies to prevent preeclampsia for those who have high risk factors. But if someone were to receive a diagnosis, how is preeclampsia typically managed?
So, management for preeclampsia really depends on how far along someone is in their pregnancy and how severe the condition is. For milder cases early in pregnancy, we often monitor closely, checking blood pressures, labs, and fetal well being. If blood pressures are high, we may even need to start medications. Ultimately, the only definitive cure is delivery. So, the timing of delivery becomes a key part of management, balancing both the maternal and fetal health needs. This can be a difficult decision and is usually made together with the patient, their obstetric provider, often including a maternal fetal medicine specialist, and sometimes neonatal or baby specialists as well.
And how does having preeclampsia affect the actual pregnancy, and does it cause any harm to the baby?
So, preeclampsia can affect the pregnancy in a few ways. For the mother, there are risks related to high blood pressure and organ involvement, and she can even have more severe complications like seizures, fluid in the lungs, or kidney failure. For the baby, it can affect growth, amniotic fluid levels, or lead to earlier delivery. And like we talked about before, early delivery is a decision made with the expertise of many specialists and may be necessary to save both mom and baby. However, with close monitoring and appropriate management, many patients go on to have very good outcomes.
Does having preeclampsia change someone's birth plan or force them to have a C-section?
Not necessarily. Having preeclampsia doesn't automatically mean a C section. Many patients can still have a vaginal delivery. What it often does change is the timing of delivery, and a delivery earlier than the due date may be recommended depending on the situation. Also, in general, I do try to gently remind patients not to get too fixed on a specific birth plan or envision exactly how they want their delivery to go, because sometimes things don't unfold that way. The focus really becomes having a safe delivery for both mom and baby, even if that looks a little different from what you had originally expected.
What warning signs should someone be watching out for if they have preeclampsia, or what type of things should make them go to the hospital?
This is a really important thing. So, once someone has been diagnosed with preeclampsia, it is still important to watch out for the same symptoms that we spoke about previously: severe or persistent headaches, vision changes, right upper abdominal pain, shortness of breath, chest pain, or decreased fetal movement, or feeling generally unwell. If any of these occur, or if blood pressures are very high, that's when you should seek care right away or go to the hospital.
And I think if anyone has seen on TikTok or online about anything about preeclampsia, they've probably heard of magnesium being administered in the hospital. And a lot of people talk about their experience with magnesium, and it's not always the best. So I wanted to ask, why is magnesium sometimes given during delivery or postpartum? And what can patients expect to feel when receiving that medication?
Yeah, magnesium is one of these medications that is extremely common in obstetric care. We give it for a lot of things. If you go back to the headache episode, we talked about having magnesium in pill form to help prevent migraines or headaches. But when someone has preeclampsia, we give magnesium to help prevent a severe outcome of seizures in people with preeclampsia. So it's very important to stay on the magnesium even if you don't feel well when you have preeclampsia. Patients often feel warm and flushed and often have a little bit of fogginess or feel tired while they're on the magnesium because it relaxes everything in your body. So it can feel a bit uncomfortable, but we monitor people really closely, and it's really important to stay on the medication for mom's safety and baby's safety.
Okay. And the magnesium in the hospital is given
It's
IV.
given IV and at very large doses, which relaxes the body a lot.
Got it. And that's different than if you're having headaches, you might have a lower dose in an oral form.
Yes, it's like a little pill.
Okay.
Yeah, that makes sense. And after someone has made it through the delivery and the postpartum phase, can they expect that their preeclampsia will just go away after birth?
Yes, so preeclampsia usually improves after delivery, but it doesn't always go away immediately. Blood pressures can remain elevated for days to even weeks postpartum, so monitoring blood pressure once you go home or again watching for symptoms is crucial. Early follow up with your obstetrician is really important to get your blood pressure checked or to continue checking your blood pressures at home. And typically, we see people improve by around 6 weeks postpartum, but some people can take up to 3 months. And if this helps anyone, the word preeclampsia comes from a Greek word which means like lightning. So preeclampsia happens fast. One day you're fine, and the next day you're not. And it also gets better like that. One day you have high blood pressure, and suddenly it goes away. So it really can be quite sudden, and so you have to keep up with monitoring your symptoms and seeing how you're feeling and checking blood pressure.
And can preeclampsia happen after pregnancy as well, like in the postpartum period, or is it only happening during pregnancy?
So that is a really good question. We are actually seeing a lot of postpartum preeclampsia, and about 25% of our cases of preeclampsia are occurring within the first 2 weeks after delivery. So notifying people who are a little bit higher risk, like who have had chronic hypertension or maybe gestational hypertension but not full-blown preeclampsia, those patients should be monitored closely and could develop preeclampsia postpartum.
Okay, so even though you delivered the baby, like you said, you're not completely out of the woods yet. You still want to make sure that you're monitoring your blood pressure and, alerting your provider if you have any symptoms that are concerning.
Exactly.
Okay.
And we'll get to it in future episodes, but this is why it's so important to attend those appointments postpartum with your provider so that they can really make sure that you're returning to baseline as we expect after pregnancy. And on that note, does preeclampsia have any effects on your future health or future pregnancies?
Yes, this is actually, I say this for everything though. Yes, actually, this is one of my favorite topics to educate and talk about to both patients and to other internal medicine doctors and obstetricians. First, we talk about the fact that having preeclampsia once does increase this patient's risk of it happening again in a future pregnancy. Second, I talk to patients, and this is really important, that I want these young patients to understand that having preeclampsia is associated with a higher lifetime risk of cardiovascular disease, including chronic hypertension, stroke, and heart disease. So it becomes an important part of someone's long-term health history and something we need to continue to monitor even after pregnancy, decades after pregnancy, even when you're 60 years old, especially bringing it up at annual primary care visits. This is also an opportunity to really focus on long-term health, making thoughtful choices around a healthy diet, regular exercise, and overall lifestyle choices to help reduce future cardiovascular risk.
Those are great points to bring up. And to close out our conversation today, Dr. Mitta, do you have any advice for moms who have just received a diagnosis of preeclampsia?
My advice would be to first take a deep breath. This is a lot of information to take in. But this is also something we in the medical field see often, and you're not alone. I would hope that all patients stay engaged with their care, ask good questions, and don't ignore your symptoms. Know that your obstetric team is watching you and your baby closely to keep both of you safe. And again, this is not something you caused. The goal is to support you through it and to get you to a safe delivery with both you and your baby healthy and well.
Thank you so much for that amazing advice, Dr. Mitta. We are so grateful to have had you on the podcast for a second time.
Thank you. It's been a pleasure. And just to reiterate, I really love being able to advocate for improved medical care for pregnant patients and to help educate women about their bodies and their health. It's such an important part of what we do. So thanks again for having me.
Thank you.
And now to mention a couple of relevant resources, the Preeclampsia Foundation is an excellent support resource for patients that you can access for more information on the topic, to learn about events, or to keep up to date with new research.
And the Rhode Island WIC program, as we've mentioned in previous episodes, can help you access healthy food options during pregnancy and postpartum, which is important in managing preeclampsia and supporting your pregnancy in general. We'll link the website in the show notes for you for the WIC program as well as the Preeclampsia Foundation.
Thank you so much for joining us on today's episode of the Road to Pregnancy podcast.
Don't forget to follow us on Instagram at Road to Pregnancy for updates, helpful tips, and more pregnancy-related information.
See you next time.